The following patient underwent a surgical procedure utilizing the SafetyFix EasyOut bone screw system. All metallic surgical hardware was removed in 16 weeks. Presented is a summary of the recovery process, activities, and footwear. This patient is now free of metal hardware. Included in this presentation is a chronological view of a patient that underwent multiple surgical procedures utilizing the SafetyFix EasyOut bone screw system. We will present pre-op and post-op x-rays and views of the foot before and after bunion, toe, and metatarsal surgery. This video demonstrates the SafetyFix EasyOut process from both the doctor and the patient perspective. The final section provides the opportunity to view the actual explantation as performed by myself at the Mid-County Surgery Center. Patient Martha is here. She's status post-bunion and lesser metatarsal surgery. She had a while osteotomy of the second, and we straightened out her great toe and her bunion. She's got a normal amount of edema, as you can see post-op. Martha, how many weeks are you post-op now?
6.
6 weeks. Good. So, I'm going to put her foot through a range of motion, take a look at her scars. Scars look good. They look like they're going to heal really well. I'm loading her foot. Her foot looks good. She's got good relative toe position. This second toe is in a decent position here, and the range of motion is phenomenal at the first metatarsal phalangeal joint, which is very important. Can you move the great toe a little bit for me? Good, good, excellent. So she had some subsecond pain that we corrected with a shortening osteotomy, and in each case we used the SafetyFix screw. So I'm palpating the SafetyFix screw here, and then I'm palpating it here, and I'm palpating, hold on, I'm palpating it here. There you go. So currently she is, where's the shoe you
what's
brought?
underneath the...
Okay, we're going to unveil the shoe that she brought. So she's wearing her surgical shoe. So I'm going to let her at this time get back into tennis shoes like what she's wearing on this side. And when I push on your foot, you feel nothing, right?
Right.
I mean, just good. Okay. I don't want to lead you. You just tell me.
Yeah, no, I don't, no pain.
No pain. So I'm pushing directly over the SafetyFix screw for the while osteotomy. And she doesn't feel anything out of the ordinary. Pushing over the SafetyFix screw, which I can easily palpate, but she's not feeling anything out of the ordinary. I'm putting her great toe through a range of motion. It's got an excellent range of motion, and she's doing very well. She's got a little bit of post-operative, a normal amount of post-operative edema, and great position, and she's ready to get into a shoe right now. So we're gonna give you full permission to get into a shoe. So in terms of activity level right now, how much mileage are you doing on your feet, or how much work or walking are you doing?
I mean, even when I walk my dog, that's like a mile that I do that.
Are you walking your dog?
Yeah.
Okay. Now, are you walking your dog with your surgical shoe?
Yeah.
Okay. That's quite marvelous. Okay. That's amazing. But really, reality is back to tennis shoes as soon as you're ready, because it's great that you can do that. There's a lot of patients that can't walk that long. So you heard it. She walks her dog for about a mile at this point, and then it'll be very interesting to hear what you have to say as we get you back into footwear.
Okay.
So today we're just going to redress her and see her back for her follow-up. All good. December 27th, 2016, I'm with patient Martha. She's 8 weeks status post bunion and while osteotomies of the left foot. You can see a surgical incision here and a small incision here. We tested her for screw prominence, and it's negligible. She doesn't feel any pressure over the screw heads. I feel that this is a prominent screw right here. She says at the most a 1 out of 10. So there's just no problems with this. She's ready to start attempting to run. So she's asked today if she can start running. I'm going to ask you a few questions, but I just want to show that your range of motion is great. We love that. The position of the second toe is good, and basically her foot is functioning well enough to where I'm going to allow her to start running. So I'm going to ask you some questions. So tell us how it's gone so far, and tell us about your post-op recovery.
Okay, post-op recovery was very easy. I hardly had to take any pain medication whatsoever. I maybe took 3 right after. We made the mistake of getting a new dog right before I had surgery, so then even in my boot I was able to walk right after post-surgery because I was home by myself with the dog. So not a lot, but I was able to do that.
Your activity before we did the surgery, what have you been able to resume thus far in terms of activities?
I could walk, now I'm walking like 2 miles a day with my dog. And then I'm back to work. I went back to work a week and a half ago. I'm a pharmacist, so I stand 9 to 10 hours a day. And no real discomfort except maybe at night a little bit of swelling, which that'll eventually go away, but it's been great.
When you were prior to, what was your exercise regimen prior to surgery, and you do plan on getting back to running, and what do you plan on doing in terms of the mileage of the running, or what are you used
before running, I mean, before the surgery, I would run like maybe 3 to 4 miles about 4 to 5 days a week. Right before the surgery, I was able to run, but not very well. I did a 10K and a 5K the same weekend. And so I want to get back into it and get back to maybe doing another half marathon. That's what I used to do, but it was just getting too hard.
So what I'm going to allow her to do is to start running right away. She's 8 weeks post-op. She's scheduled for the fixation removal at 12 weeks post-op, and we'll interview you at that time and ask you how you're doing.
Okay.
So we are on record for walking comfortably and being comfortably, standing comfortably. It's a normal amount of edema for this time post-op. And all in all, we're doing very well. I will ask you these questions again post-operatively, but you can answer them right now. What motivated you to have your doctor use SafetyFix EasyOut bone screws?
I just like the idea. I went to see a presentation you had done at a hotel one time, and I just like the idea of nothing left in my foot after the surgery, no screws remaining.
Thus far, would you recommend it to a friend?
Oh, I already have.
Good. So you've got friends that are.
They should be knocking at your door any day.
Very good. Okay, thank you. Okay, it's February 10th, and we're with patient Martha, and she is status post while osteotomy of the second with the SafetyFix screw and an Austin and Aiken. So we've got 3 SafetyFix screws in, and we're going to be removing them today. And you are at this point more than 2 months post-op?
Oh,
yeah.
Like
3 months.
Almost 4.
Almost 4 months post-op. Okay, last time I saw you, you were getting back into footwear.
Mm-hmm.
You've been in footwear now for a while.
Right.
How are you doing?
Doing fine. I'm running. I'm back to running at the park, so
Beautiful.
everything is great.
So here we're just simply documenting that with the SafetyFix screws in, she's able to get back into tennis shoes and run and do everything that she was doing before. And now we're going to remove the screws, and I'm going to give you permission to run as soon as you want. So 3 screw removals through small incisions, and you're going to be back to running.
Okay.
Okay. So did you bring your shoes here, or
Yeah,
somewhere
they got
around?
it
They
somewhere.
got
One of
it.
the nurses
It's a locker.
took mine.
All
No,
right.
my nurse took them or something.
Very good. Okay, so these are the screws that show the fixation. We'll show x-rays of these on the video, and she's doing great right now. We'll show the before and afters also. There's quite a bit of reduction here. Okay. Okay, so what we've done so far is we've numbed the patient up and put a tourniquet on the patient so that we can get accurate placement of the screws using needles. And essentially what we have now are 3 screws in, and we've used 3 27 gauge needles to place directly over the screw heads. And now we're very, very familiar with where the screw heads are for our incision placement. Okay. Got it? So now what I'm doing is I'm holding the driver as a pencil, and I'm finding the screw head and finding where there's tension on the screw head. When I feel like I have tension on the screw head, I'll climb the driver and start to feel the screw explant. And you should feel, again, that the screw, that there's some tension on the screw, and that's how you know that it's explanting. at this point, the head should come through the wound as it is, and we should see the head. So close-up of this will demonstrate that there's the head of the screw, and it's as simple at this point of as just pulling out the head. So right now, all I'm going to do is just take the head and sort of pull it out, and now you can see that this screw, 1425 screw, is just pulled out of a very tiny incision. Very, very little trauma. You can't do this. You simply can't do this with oversized screw heads or anything else. You need to have the elevation in order to get there through an incision this small. Okay? Okay. So now I'm going to double check with my needle. I've already used fluoroscopy. I can feel the screw head just below the needle, so I know I'm in the right position. I've marked with a marking pen where I need to make the incision, and you just stay right over that. Just a tiny, the tiniest of stab incisions should be all you need, right above the screw head. You should actually, on these, even be able to feel the screw head with the blade. So that now is going to be widened. I use a small curved hemostat, and that incision now I can stretch a little bit to accommodate the driver. And again, the tip of my hemostat is on the screw, so this is going to be exponentially easier, simply because I can already feel where the head of the screw is relative to the extensor tendon and relative to the incision right now. So I'm just essentially stretching the skin a little bit, and next we'll place the driver in. There, you good? Okay. So now we're using the driver again to locate the screw head, and once we feel that the screw is located with the driver, and you can do a little dissection with the driver also, a little blunt dissection, just to make sure you're on the screw head. Again, you're going to climb the screw head, and you're going to go slow at first, and just feel that screw coming out. You'll feel that torque, so you know you actually are on it. These screws have purchased very, very well, so they're coming out very easily. You'll see now when I take the driver off the screw, it's peeking through the wound, and we're really only a couple turns away from getting it out of the wound. I believe I need a few more turns here to get it out of the wound. There it is. So now that's a 16 millimeter 2.5 screw through. That's about a 3 millimeter incision right there. So far, so good. It looks like she's going to be able to run tomorrow after her screw removals. Okay? So all we're doing here is illustrating the 3 screws were used to fixate 3 osteotomies. They were removed in less than 20 minutes through 3 incisions, 2 of which are approximately 3 to 5 millimeters long, and 1 which is about 10 millimeters long. Very good. So it's February 18th, and we're with patient Martha, and she is now, how many days status post?
7.
7 days status post excision of hardware. And what we have are 3 incisions. One over the Weil osteotomy of the second, one over the bunion, and the second at the Aiken osteotomy. She healed really, really well, and all I want you to do is relate your experience immediately after the suture removal, or the implant removal.
Right. Okay. I didn't have any problem. I actually went out for breakfast afterwards.
After the surgery.
After surgery, and then went home and just kind of put my foot up, and I mean, I had a little bit of pain, but it wasn't from that. I think it might have been an injection, maybe right here. Was there some kind of injection there?
Pain from the anesthesia.
Yeah, so that was the only pain I experienced. I had no pain at all.
And you were active the next day?
Next day, went shopping with my daughter for a little bit, came back, rested, and then went back to work on the day after that, and I've been working 9-10-hour days since then.
So
standing on my feet.
To review, you're a pharmacist, you're on your feet a lot.
Stand the entire time.
Today we're going to take a nice close-up of her foot or post-op. Everything looks great. Range of motion of the great toe is great. The incisions are super small. Sutures are going to come out, and we will see you in 3 months.
Okay.
All right.
All right.
Very good.